Welcome to Integrative Medicine Perspective. I'm Dr. Winli Liu. Weight management is a big part of integrative medicine practice. One of the main strategies of weight management is appetite control. There are medication interventions and dietary manipulations to help suppress appetite. Before we dive into the pros and cons of each method, let's talk about hungry feeling first. Weight loss requires a negative energy balance that can be created by reducing dietary calorie intake. However, our body, being alert and responsive, can quickly sense the negative energy balance and react with strong signals to increase appetite. There comes our hungry feeling. As a matter of fact, our body is so protective of our weight, its effort to regain the lost weight, or I should say the hungry feeling, can last years after the weight loss is done. Though our body's reaction is normal and physiological, it certainly makes our weight loss effort challenging, to say the least. So how do we manage the increased appetite? Medication interventions work centrally to make us less sensitive to the appetite-encouraging signals produced by the negative calorie balance. There are several considerations of this method. One is how healthy it is to suppress a normal physiological function for months or even years. Plus, these medications do not control appetite effectively and precisely in a way similar to those that control high blood pressure or high blood sugar. In other words, their effects on the appetite are not very predictable. But most importantly, there are no randomized controlled trials comparing long-term health benefits of weight loss produced by medications versus by healthy lifestyles. After all, weight loss itself, it's not the ultimate goal. Improving overall health and preventing diseases are the long-term goals of weight loss. Next, dietary manipulations is often used to help suppress appetite. Large amounts of protein and fat intake, such as a high-protein diet or a high-fat diet, can help suppress appetite. Because our body's ability to absorb protein and fat is limited. When their intake exceeds our body's ability, the unabsorbed protein and fat can act as a signal to our body that we have more than enough, so the appetite is suppressed. Though it may seem that we can eat more calories from protein and fat and at the same time lose weight, the unabsorbed protein and fat are unhealthy to our colon. They are toxic to the bacterial community in the colon, which we now know has many metabolic and immune functions. Plus, when the protein intake exceeds our body's structural needs, like building muscle, it will be used to generate energy. Protein as an energy source is definitely not a clean type. The burning of a protein generates wastes like ammonia, which are inflammatory to our body. Last but not least, high protein or high fat diets are prone to nutrient imbalance. So if we're not in favor of either the medication method or the dietary manipulation of protein and fat content, can we do something about the hungry feeling? The answer is yes. I think we can and should use the hungry feeling as a tool for weight management. When the hungry feeling starts, very likely the negative calorie balance has begun. Based on how severe and tolerable the hunger is and the actual speed of weight loss, we can adjust our weight management strategies. This adjustment can be fine-tuned to make the hungry feeling just a signal of the negative calorie balance, but not an intolerable struggle or an enemy of our weight loss effort. Last, but also importantly, a dietary manipulation should not jeopardize the adequacy and balance of nutrients in the diet. Weight management is certainly far more complex than a short video can cover. I highly encourage people who desire weight loss to talk to your primary care physician, an integrative medicine clinic, or a weight management clinic about healthy lifestyle changes. I hope you find this video helpful. Please leave comments and questions below. If you're interested in integrative medicine topics, please subscribe. I will see you soon.